Good morning, everyone. Welcome to today's live update on this beautiful October day. I'm Chancellor Donde Plowman. Before we start, once again, I want to remind everyone to be sure and get your flu shot. It's not only required for students and employees, but it's an important safeguard in protecting our healthcare system and one another as we head into these colder months. Our next flu shot clinic is October 20th at Thompson Bowling Arena. You can find more information on how to register by going to the campus calendar at calendar.utk.edu. Today, I have with me Vice Chancellor for Research, Deb Crawford, and Dr. Spencer Gregg, Director of our Health Center, to talk about data, testing results, and strategies, and what happens when you leave campus, students, for the holidays and winter break. So let's start with the latest case count. We currently have 49 active cases, 46 are students, and 3 are employees. Today's total includes 18 new recoveries since yesterday. So we see the shape of that curve. It's very, very distinct there. There were 3 new active cases reported yesterday. We now have 322 people in quarantine or self-isolation. Of those, you can see there that curve follows exactly the one we just saw. We now have 322 people in quarantine or self-isolation, and of those, 287 are students. And you can see there now the larger divide on that last bar is more non-residential students off campus than residential students. So before I say more about what I think that means, Dr. Gregg, what do you see in these numbers today?
Good morning, Chancellor. It's good to be with you again today. With these numbers, I'm pleased to see that since we last spoke, our overall active cases have shown a decrease. Through the past week, as well as the past couple of weeks, you can see that we've hit more of a plateau in active cases, and this despite our increased testing across campus and the identification of more asymptomatic cases. So I'm very pleased with what appears to be a general flattening of our campus curve for active cases. It appears that our new cases have been trending the same over the past couple of weeks. On our graph of new cases, we've generally seen a decline over the weekends, probably due to less testing through the health center, and then a relative spike of new cases on Mondays, and that tends to trend down through the remainder of the week. We are seeing a gradual increase in the number of self-isolations, however, but as in the recent past, this increase is due more to the number of close contacts and the need for individuals to quarantine. That's especially true for our students that are residing in our off-campus housing.
So anything else that you see just in the student health center, or what are you hearing from our contact tracers? What else are you seeing there that you could add?
At the Student Health Center, we've seen a general increase in the number of students getting tested, and most of this is driven by the saliva testing that's occurring on campus. Many of our positive cases are students that have no symptoms of active infection. From the standpoint of our contact tracing team, they did recently identify a cluster on campus, and this is our first cluster in several weeks. This was recognized in the Army ROTC program, and their efforts in assisting our contact tracers was greatly appreciated. Also, as we've noted time and again by our contact tracers, those living together in a household and those socializing in small groups where social distancing guidelines are less likely to be followed, they still remain a major driver behind both our isolations and our quarantines.
Okay, well, thank you. So let me just add a little bit more to the new cluster. It was a large cluster, it seemed like, originating from ROTC meetings took place in Hoskins. The cluster was identified October 12th, and it includes 27 close contacts and 2 positive tests. The asymptomatic positive individuals, and this has kind of been the trend we're seeing, asymptomatic positive individuals were identified because the detachment was proactively testing cadets as part of their planning and preparations for field exercises. The proactive testing practices helped identify cases so further spread of the virus could be contained through our contact tracing efforts. And I'm really, really grateful for the cooperation of our students and their leadership. This is exactly how it should happen. Do you agree with that, Dr. Greg? I mean, in a
Definitely.
perfect world. So as they were preparing for an event, they tested asymptomatic people. There were several close contacts, and that accounts for that cluster. So we know what's going on there. Finally, we have added 2 new tables to the data that's on the website, and we're presenting those today. This first one shows the results of our residence hall saliva testing. So take a look here with me. The first table shows the community saliva test results each week. So week by week, you see 3 weeks there. As you can see, last week we tested Carrick North, Carrick South, Fraternity Park, and we had a day of makeup tests for anyone who missed their original testing window. A total of 1,124 samples were processed in batches of 3 to 4. A total of 58 individuals were referred for diagnostic testing, and 11 of those had a positive PCR swab so far. You can also see the participation rate, which dropped below 50% last week, and not happy about that. As a reminder, if you live in our residence halls or sorority or fraternity housing, you are required to participate. And this testing will be going on throughout the next spring semester. So this is a table people will become familiar with. In the second table, we see the PCR tests that are administered each week at the Student Health Center. This will also be updated weekly. Now, it represents tests administered to symptomatic students, asymptomatic students who are close contacts of individuals diagnosed with COVID-19, and any student who's been in positive pools through community saliva testing. So here you see that that last week the Student Health Center administered 104 tests with 84 negatives and 20 positives. Both of these new tables will be updated every Monday. All other charts and graphs will be continued. We'll continue to update them daily. So Dr. Greg, I want to come back to you a minute. So let's talk again about what do these comprehensive testing results show us?
I would say 2 major things. First, thankfully, because of the comprehensive testing, we're now better able to identify asymptomatic positive cases on campus. These are individuals who, due to their lack of symptoms, may have never been tested. And by identifying them, we've reduced their likelihood of spreading the infection. Second, I think these results indicate that we definitely need to see broader student participation in our testing efforts.
So let's just talk a little bit. How have anything else you could say about the participation rates, how they've trended this week? Are the makeup test days helping? Kind of how is that working? Our
participation rates are suboptimal. We would like to see those rates, as high as in the 90th percentile of students that are actually living in the residential site that's being tested. But the best we've achieved at any one site is in the 70th percentile, and the lowest has even been 40%. And we're working on ways to improve participation rates, incentives, so to speak, but haven't yet settled on what those can look like. The makeup tests are helping, but they're still not getting us where we would like to be. Broader participation is going to be the key to the success of this program.
Okay, so stay tuned on that. More to learn, more to discover, more to plan. So now I want to turn to Vice Chancellor Dr. Crawford. Now that we're several weeks into this testing or research, tell me more about what we're doing when we conduct sampling at the residence halls. Where do the samples go? How do we analyze them? Fill us in there.
Absolutely, Chancellor Plowman. In this, our 4th week of testing, we've ramped up to where we're requesting saliva samples from anywhere from 1,500 students to 2,000 students a week. So in contrast to situations where individuals only choose to go and get tested when they don't feel well, our saliva testing campaign helps us assess the overall health of our student community. So currently we have the capacity to test up to 2,000 students a week. all of whom believe they're healthy because they're not experiencing any symptoms, as Dr. Greg said. This is a really valuable testing strategy because it helps us understand the extent to which the SARS-CoV-2 virus is hiding among us, undetected by the individuals who are carrying it. This approach to testing isn't available nationwide because states and municipalities simply don't have the resources to do it. If we were able to deploy wide-scale testing of all individuals on a national scale, we would have been able to curtail transmission of the virus much more effectively, and we wouldn't have lost so many lives to the COVID-19 disease. So students give us their saliva samples in the morning within an hour of waking up and before they brush their teeth or have anything to eat or drink. Every residential student gets a glass tube to spit in. They cap the tube, they put a sticker on it that has a barcode on it that's unique to them, and they give one of our health center staff the tube for processing. They usually deposit the tube in a cooler that's in the residence hall main entryway. The tubes are transported to the lab of Professor Frank Loeffler, who's one of our governor's chairs for processing. There, the samples are grouped together in what are called pools for testing. Testing in pools helps us analyze samples at scale. So we're presently testing up to 500 samples a day in pool sizes, as you saw on the table, of 3, 4, or 5 individual samples. The analysis technique that Professor Loeffler and his team use is the same as for nasal swab testing. They use a PCR machine to detect fragments of the SARS-CoV-2 virus, in saliva in this case, and in material collected from the back of the nasal cavity in the nasal swab approach. For saliva samples collected in one morning, we usually have the pooled results by the end of that day, so really fast turnaround. If a pool of saliva samples is identified as positive, it means that one or more of the saliva samples in the pool have virus fragments in them. So in a pool of 5 samples, anywhere between 1 and 5 samples might actually be positive. By first looking at the number of positive pools, we begin to get a sense of prevalence of the virus in the community of students who gave us their samples. Remember, these students don't believe they have the virus, unlike most people who go to get tested for COVID-19 because they feel unwell. Professor Loeffler's lab then sends us only the barcodes of samples in the positive pools to the Student Health Center. Student Health Center staff then associate the barcodes with specific individual students who are then contacted to come in for individual nasal swab testing. This second step is necessary because 1, the samples have only been tested in pools of 3, 4, or 5. They haven't been tested individually. And more importantly, the CDC currently recognizes only the nasal swab test as a diagnostic test for COVID-19. Students contacted come to the Student Health Center to be nasal swabbed. Their samples are sent to a commercial reference lab for testing, and the results are usually returned within 24 hours. And students who receive a positive result then have to self-isolate, and our contact tracers do their work and start the contact tracing process. To keep themselves, their friends, and their community safe, it's really, really important that students give us their saliva samples when they're asked to do so. And it's really, really important that they also respond immediately to the Student Health Center if they're asked to come in for a nasal swab test. It's important to remember that not all samples in a positive saliva pool are likely to be positive. Only 1 sample of the 5 needs to be for the pool to become positive. And in fact, that's what we're seeing now. Maybe 1 or 2 positive samples in every positive pool of 5 samples. So students who are contacted by the Student Health Center need to go there to be tested by nasal swab to determine if they actually are COVID-19 positive.
So thank you. You've described in detail one really important part of our testing strategy. We have sort of a three components, the way I think about it, to our testing strategy, which is the health center tests students with symptoms who are close contacts with the PCR testing, and then our systematic testing with pooled saliva, and then we'll talk in a minute about wastewater. We discussed this strategy extensively with Dr. Burks when she was here, and it was I spoke then about how important it was to us, how wonderful. We learned a lot. She was very complimentary of this strategy, and I'm really eager for us to continue this and to get the participation rates up there. So, Dr. Crawford, if you could just say a little bit more, what are we finding with these results? I mean, we're getting the pooled saliva, students are going to the health center. What are we finding? What are our results, and how are we responding to these results?
So you can see in the table, Chancellor Plowman, that you showed earlier, that our pooled saliva testing is helping us to identify asymptomatic students. And as Dr. Gregg indicated, that really helps us get out ahead of things, right? So that we don't have this virus silently being transmitted amongst our students. We've identified 26 students living in dorms and fraternity houses tested over the last 3 weeks who were experiencing no symptoms but were actually carrying the virus. We'll continue to monitor the weekly positive rates to determine if we can lift some restrictions in place on campus, or if new restrictions need to be put in place to limit virus transmission. The results also help our student health center colleagues and community healthcare providers more broadly anticipate how many students may need medical assistance in the coming weeks.
Okay, so the last part of our strategy, wastewater testing. What can you tell us about that today? What about that?
Absolutely. So Professor Hazen, who's also a governor's chair at the university, and his team are continuing to refine our wastewater testing techniques. They do continue to detect traces of the virus in wastewater on a weekly basis in one or more of our residential facilities, but they're still adjusting their sampling techniques to try to better understand how the results from these tests can be most valuable in monitoring virus spread. In the context of this pandemic, wastewater epidemiology is still an evolving science.
Okay. Well, thank you so much for that great explanation. And we look forward to more results and learning about all the things that we're doing with what we learn. The last thing I want to talk about this morning before we sign off is it's hard to believe that we're more than halfway through this semester. And next month, students will be returning home for the Thanksgiving holiday and will not return to campus until late January. So let's talk a little bit about transitioning home. These academic calendar decisions were made to limit travel to and from campus and to keep from spreading the virus. However, we also don't want students to leave campus and transmit the virus if they're asymptomatic to their families or their communities back home. So Dr. Gregg, I'm going to loop back around to you. What should students do to ensure they're keeping their families and their communities safe when they return home?
I think that the key to keeping others safe is to follow the same health and safety guidance that we've encouraged since the onset of this back in March. If there were only 3 things that I could recommend, that'd be 1, wear your mask when you can't be certain that you can keep 6 feet of distance between yourself and others. Number 2 would be avoid group social settings, more than 3 or 4 people as much as possible. But if you're in that setting, wear your mask, keep your distance. And third would be to wash your hands or use alcohol hand sanitizer frequently. And let me add a 4th one too. Please stay home if you're sick. Beyond those measures, we'd also encourage students to think about getting tested before leaving for home. On day 1, when most of us are back at home, because of Thanksgiving, we're probably going to be around people that we've otherwise not been in contact with for quite a while. Many of those are going to be people that, because of their age or health conditions, have been doing their level best to stay safe. You don't want to be the person that got Mamaw infected. Knowing that you're positive would certainly impact your plans. So getting tested before you leave is not a bad idea.
So let's talk about that. Is the following statement true, Dr. Gregg? We will test any student who wants one at the Student Health Center. True or false?
That's true.
Okay. There was a question right there, and it was a quick answer. Didn't beat around the bush. So that was great. I got another one for you. When should they get the test, and what should they do while they're waiting for the results?
Well, getting that test as close to your planned date of departure and then staying safe subsequent to that test is imperative. You have to keep in mind that we have at least a 1 or 2 day turnaround time on being able to tell you your test result. So you should plan for that as well. For instance, if you're going to depart on, let's say, Friday, then getting tested no later than Tuesday or Wednesday would be best. Because again, you can't get tested on Tuesday morning and then go out with a bunch of friends Tuesday night where you're likely to be exposed. So you got to be able to stay safe during that time period, and then allow us time to get your results back to you so that then you know how you need to proceed going forward.
So I want to just pick up on that. If you get tested, the test result won't be meaningful if between the time you were tested and you got the result, you were out around other people who could have infected you. So for the sake of your mom, your dad, your grandmother, your grandfather, your aunt, your uncle, all those folks, please get a test and then keep yourself confined until you get the results of the test before you go home. So let's talk about employees for a minute. What about employees who need a test? Where should they go?
We will have our Everlywell COVID-19 at-home collection kits available for asymptomatic employees to use. And we'll be putting out information about those kits to university employees next week.
Okay.
If you're an employee and having symptoms, we would request that you see your healthcare provider so that you can have both an evaluation and get tested, especially as we're moving into the flu season. Additionally, as always, employees can get tested through their healthcare provider in the local health department.
And how much time does it take for employees to get the turnaround on that test? Same kind of time?
The Everlywell kits, actually the employee will find out about the test results before we do. We request that they notify us once they've been notified. And what we've been experiencing where we've used those, and we've distributed over 500 of those so far this semester. The turnaround time for those is averaging more 2 to 3 days.
Okay.
So maybe a day longer than what we can do when we're doing the test here through the Student Health Center.
So if employees are traveling to enjoy Thanksgiving with family, they need to do the same thing as students, and you can use those kits and look for information in the email about that in the coming days. Well, I want to thank Dr. Gregg and Dr. Crawford for being here with me today, and thank you to everyone who's on this call. Tomorrow, the Vols take on Kentucky right here at Neyland Stadium. As always, please remember to cheer on the team responsibly, whether at home, a social distanced gathering, or in the stadium. For our students who don't have tickets to the game, you can get tickets to Smoky's Game Day experience at the Trucks Field. There'll be food and fun along with the Jumbotron to watch the game together with others outside, socially distanced. In order to maintain the socially distancing, attendance will be limited to 200 students. So visit calendar.utk.edu for more information on requesting tickets. Thank you, everybody, and be safe. Let's have a great and safe weekend. Go Vols.